Washington, more than 5.16 million people have gotten at least their first dose of a vaccine, which works out to be almost 68% of that state's entire population, including kids. So you can see there's a lot of people in both states who haven't gotten a vaccine yet. And I want to talk about some of the impacts that is having, and not just on the people who choose not to get the vaccine, but really everybody, our whole community. So let's turn and talk to Pat Dooris for just a minute. Pat, you've been spending a lot of time focusing on our overwhelmed hospitals. Let's talk big picture first. Can you give us an idea of what our hospital capacity looks like right now?
Yeah, it's still pretty slim. About 1,162 people in the hospital this afternoon and this evening. 6% availability for ICU beds, 7% for all non-ICU beds. That's pretty thin.
Now, we've been getting a ton of emails, a lot of them coming to the story, some of them going directly to you. And I'm wondering what you have heard, because I'm seeing stories of people who are unable to get into the hospital for care that they need because of COVID patients taking up all the beds. Can you share a few of those that you've gotten with us?
You bet. I mean, some of them are things that you might expect, people who need hip replacements or knee replacements. And it's just heartbreaking to read through their emails and see how much pain they're in and how they were really looking forward to this surgery, and then kind of the rug got pulled out from under them because there's no availability to stay overnight, or sometimes even to do just the day in and out surgery because there's no place to recover in there. I've also heard from a woman who has a feeding tube in her stomach and that she needs some surgery to help straighten that all out. That's waiting. She's hungry. She's in pain. There's the hip replacements. I got an email from a man whose father has throat cancer and it's getting worse. A couple of colon cancers. It's just a wide variety of things that, just sort of happen in life. But suddenly when you can't get in to get the hospital to get the surgery, it's a really big deal. And you got to remember, one email was about a husband who had timed the surgery just perfect so that he could have all his vacation time when he recovered, because it's a slow time in the business. Well, now that's not going to happen. So they think he's going to have to put it off until December or January when the next slow time comes around.
You were telling me
things going on there.
Sure. You were telling me one of the people at the hospital who has to make those calls and tell those patients that their surgeries are being postponed or being canceled. Will you share that?
Yes. So one of the emails I got was not from a patient, but from the patient coordinator. I think she worked at one of the large medical groups. And so she would be the person who would call you and say, okay, let's do your surgery 3 weeks from tomorrow. And here's all the things you need to do. And then as it got closer, okay, we're on track. Yep, everything's good. She was the person you coordinated with. And then she had to start making all the calls in the spring when things got kind of crazy and cancel people. And then she made the following calls to reschedule them. And then she had to start making calls to cancel them again. And she said it was heartbreaking. Just person after person, you hear all their stories and how disappointed and sad they are. She finally quit that job and got out of the business because it was just too much for her.
Unbelievable. All right. Pat Dooris, thanks as always.
You bet. My pleasure.